You brush your teeth every single day. It's one of the most routine things a human being does, and it involves putting an object deep into your mouth and scrubbing aggressively. And almost nobody asks whether that's safe. The thing nobody tells you is this: the toothbrush sitting in your bathroom right now is almost certainly covered in over 100 million bacteria. Some came from your own mouth. Some came from somewhere significantly worse. Under the right conditions, that combination, the warm bathroom air, the moisture, the proximity to certain fixtures in your home, can build something on those bristles that's genuinely capable of killing you. Not theoretically. Not in some extreme edge case. Documented, measured, peer-reviewed, capable of killing you. To understand the mechanism, you first need to know what colonizes a toothbrush, and why your bathroom is one of the best environments on Earth for growing it. Start with the basics. Every time you brush, your toothbrush collects bacteria from your mouth. Streptococcus, Staphylococcus, Candida albicans, a fungus, and in a significant number of cases, fecal coliforms. That last one deserves a moment. Fecal coliforms. On your toothbrush. The reason is something researchers call aerosol contamination, and it comes down to your toilet. Every time you flush, particularly with the lid up, the force of the water generates a fine mist of aerosolized particles that carry whatever was in the bowl, and they travel. If your toothbrush is stored anywhere near the toilet, which in most bathrooms it is, it's receiving a regular deposit of that aerosol. The warm, humid bathroom environment means the bacteria landing on those bristles don't die. They thrive. They multiply. Humidity, poor ventilation, a warm room. Ideal growth conditions. Covering your toothbrush with a cap seems like it should help. Instead, a cap traps moisture and shuts out air, which accelerates bacterial and fungal growth inside. What is all of that doing to you? For most healthy adults, most of the time, probably not much. Your immune system handles constant low-level microbial exposure, and your mouth's own defenses, saliva enzymes, antibodies, the acid environment of your stomach, filter out a great deal of what comes in. It gets more serious for anyone with a compromised immune system, asthma, existing gum disease, or diabetes. The calculus changes completely. Inhaled mold spores from a contaminated brush can trigger respiratory responses severe enough to require hospitalization. Candida albicans, the fungus that colonizes bristles in humid conditions, can cause oral thrush, and in immunocompromised patients, it can spread systemically, not just to the mouth, into the bloodstream. Bacteria from chronically infected gums, the kind that builds up when you're reintroducing bacteria to inflamed tissue twice a day, has been linked in peer-reviewed research to cardiovascular disease. The connection isn't fully understood mechanically, but the association shows up consistently enough across studies to take seriously. Bacteria enter the bloodstream through damaged gum tissue, and something happens to blood vessel walls and cardiac tissue that researchers are still mapping. The European Journal of Preventive Cardiology published findings connecting oral bacterial presence to measurable increases in cardiovascular risk. The question of whether a toothbrush can kill you stops being abstract fast once you follow the microbiology. The bacteria aren't even the most immediately dangerous part. That distinction goes to the physical object itself. Toothbrushes, especially for children, cause a specific category of injury that emergency physicians see regularly enough that it has its own documented profile. A child walks around with a toothbrush in their mouth, which nearly every parent has seen. They trip, they fall. The brush drives backward into the soft tissue of the throat or the roof of the mouth, penetrating trauma. Nearly 80% of those injuries happen in children under 5, and in a small number of cases, kids swallow the brush entirely, which is its own medical emergency. Electric toothbrushes add a mechanical failure dimension manual brushes don't have. The FDA issued a formal safety warning about the arm and hammer spin brush after reports that the brush head was detaching during use and getting propelled into users' mouths at speed, not falling off gently, launched with enough force to chip and break teeth. The exposed metal components caused lacerations to cheeks, gums, and in some cases eyes. There were choking incidents. Children swallowed separated components. The FDA's language was specific. Parts released into the mouth with great speed. That's an electric motor spinning at hundreds of revolutions per minute, suddenly throwing a piece of plastic and metal at the inside of your face. The NUK toothbrush trainer set was recalled after rubber tips separated from handles and lodged in children's throats. In several of those cases, the tip had to be removed by someone else. The child couldn't dislodge it on their own. Then there's the damage that happens slowly. So slowly, you don't notice it until it's permanent. Electric toothbrushes, particularly sonic models, can erode enamel faster than manual brushes under lab conditions. The mechanism is pressure combined with high-frequency movement. Most people don't measure the force they put on a toothbrush. The instinct is to press harder when you want something cleaner, which is exactly wrong. Too much pressure against enamel doesn't clean it more effectively. It removes it. And enamel doesn't regenerate. There's no biological repair process for it. The cells that produce it, ameloblasts, die off after the tooth erupts. Once that surface layer is scratched and thinned, it stays that way permanently. What follows is increased sensitivity, increased vulnerability to decay, and gum recession that exposes root surfaces never meant to be exposed. Over years, the twice-daily habit meant to protect your teeth can structurally compromise them, and the damage won't show up obviously until it's well advanced. Underneath all of this, the toothbrush sits at an intersection of microbial biology, mechanical engineering, and human habit that we treat as completely solved. Brush twice a day, 2 minutes each time, see your dentist. The guidance is so routine it stopped prompting any questions. But the object itself hasn't changed dramatically in its basic form in decades. It sits in one of the most bacterially productive environments in your home, and most people store it within aerosol range of a toilet without a second thought. The gap between the daily instruction and the actual biology behind it is wider than almost anyone realizes. Store your brush upright, uncapped, away from the toilet. Replace it every 3 months or after any illness. Keep the lid down when you flush. Those aren't suggestions. Those are the things that decide whether your toothbrush stays a hygiene tool or becomes something else entirely.